Hello, today I'm going to teach you how to draw the heart, not anatomically, but in a diagram fashion so that you can remember the parts and pieces as well as the physiology a lot easier. So the first step is to draw a traditional heart shape, okay? And then we know that it's divided into right and left, so we put a nice thick line down the middle that will represent the cardiac septum, and then we'll label right and left. That's very important because we need to remember this is the patient's right and left, so it'll be opposite of how we're looking at it. Now you know that we have 4 chambers of the heart, so we draw a line right across there. So now we have 4 chambers. Now if you look closely here, this is the letter A. That helps you remember, when you draw this out, that the superior chambers are the right and left atrium. Here we have the letter V, which helps you remember that here in the inferior chambers we have the right and left ventricles. Now, blood circulates through. So blood comes in the atrium and out the ventricles. So we draw 4 arrows representing that. In each atrium, out each ventricle. Now, blood comes in the right side from the body, which means to circulate, it must be going out to the lungs. From the body to the lungs. So the left side must be the opposite. We're now getting our blood from the lungs and therefore going out to the body. So body pumped to the lungs, lungs pumped to the body. Now, the control of blood is the flow of blood is controlled through valves, one-way valves. So we have AV valves between the atrium and ventricle, and we have semilunar valves as we leave each ventricle. So we put our 4 valves. Now, there's a little memory device here. I'm going to show the valves in green. It's rat and lamb. Now, these are not the names. Hard to read that one there. Rat and lamb are not the names of the AV valves. Instead, it's a memory device. The right atrioventricular valve, RA, is also known as the T tricuspid valve. And the left atrioventricular valve, LA, is also known as both the mitral valve, M, and B, bicuspid valve. So never call this the lamb and the rat valve. Instead, if somebody says tricuspid, oh, you know they're talking about right atrioventricular. If you're talking about left atrioventricular, no other names are mitral and bicuspid. Now the semilunar valves, as they're leaving, are named after the vessels that they're going into. So because here on the right side, we're going in toward the lungs, we're going into the pulmonary artery. This is the pulmonary valve. And then on the left side, it's called the aortic valve because it's going into the aorta. So pulmonary and aortic semilunar valves. So that's the chambers and the valves. So next we're going to label the great vessels. So from the body going into the right atrium, this is all the vein blood. So this is the superior and inferior vena cava. That's where the blood's draining in from. And then it goes out, through the pulmonary valve. So that must be the pulmonary artery. Remember, arteries go away. So this is showing you away, so artery A, away. On the other hand, if we're coming in from the lungs, that's the pulmonary veins. Pulmonary veins. The IN at the end of veins can help you remember this is blood flow in toward the heart. Pulmonary veins bring it in. And we're pumping out. There's the aortic valve, so we must be in a great big vessel called the aorta, going away from the heart, so that aorta is an artery. All right? So this diagrams the heart, and there's lots of memory devices in it. The arrows will help you remember flow. The rat and the lamb can help you remember the names. The A and the V for the various chambers in their names. So if you practice with this, eventually you get to the point you can just knock it out in just about a minute, and then you can use this to really understand the heart and answer all sorts of questions about it.